Last
Sir,
speaker. The last speaker.
sir, thank you
The
very
last
much.
but not the least, I tell you.
Thank you very much for giving me this opportunity. Because 2 days ago you tried to dispose me of, but today at least you have given me.
Who can dispose you of?
You have been
I
very
tell you.
kind to give me 5 minutes
That
at
is
the end of a long day, and I am grateful that the Honourable Minister is here. So I want to make 5 points very briefly, because it's been a very long discussion, very rich discussion, and I want to draw the Minister's attention to these 5 issues. I don't necessarily expect him to respond to it, but I just want to flag these 5 issues for his attention and further consideration. So the first issue is relating to the budgets in the state governments. Now, sir, the expectation was that by increasing the devolution of taxes from 32% to 42%, state governments will spend more on essential sectors like health. Now, it would have been unrealistic to expect this in the first year, but I would like the Honourable Minister to review the situation, whether it has actually begun to happen in at least the second year of the implementation. So what is happening from my experience is that because the norm for pattern, the funding pattern has changed from 75-25 to 60-40, state governments are spending more money to fulfill their part of the obligation for central schemes and not necessarily expanding their level of expenditure. So I think what we are seeing in the state budgets is no doubt an increase in the state spending on health, but that increase in spending is only to fulfill the change in the norm from 75-25 to 60-40 and not in real terms. So states like Kerala, Tamil Nadu, Karnataka, I am not very concerned about, because these are states which traditionally have spent very well on health with good outcomes. But it is states like UP, Bihar, Jharkhand, Odisha, particularly the northern and central belt states, where there is need to increase public expenditure on health, which may be handicapped by the increase in the change in the funding pattern, even though the states have got more money from 32% to 42%. So I would like the Honourable Minister to keep this matter under constant review and constant consideration, particularly in the northern and central Indian states. So the second issue that I want to raise is on insurance. So it has been our experience, and this has been brought out very clearly in the report on the high-level expert group on health, that contrary to expectation, out-of-pocket expenditure has actually increased even after the introduction of insurance products. So I would like to caution the Honourable Minister not to follow the insurance-led model of health delivery. Insurance has an important role. We must harness that role, but I think to give insurance the central place in our health planning, as seems to be the case in the last 2-3 years that I have been able to pick up, is, I think, being a bit too unrealistic. I would like to urge the Honourable Minister to go slow on the insurance-led model and focus more on the public health delivery, which has traditionally been the pattern that our health system has been founded on. So the third issue that I want to raise is on the structure of the National Health Mission. So then, yeah, please.
How 49% of FDI, how they can be accommodated
Well,
if that is not done?
So let me not respond to that now. So the third issue that I want to raise is on the National Health Mission. So I had this debate with Mr. Ghulam Nabi Azad when he's not here. I had this debate with Dr. Ambumani Ramdas. Unfortunately, I failed in that debate, and I would like to revive that debate once again with my good friend, Mr. Nadda. So, what has happened is, the National Rural Health Mission has become the National Health Mission. But everything, all health program has become the National Health Mission. Even the National Communicable Disease Program is now part of the National Health Mission. To my knowledge, a mission means a clearly defined objective, a clearly defined cost parameter and a clearly defined performance parameter. Now, what has happened is all programs, and this happened in the UPA government, it is happening in the NDA government, all programs in their totality are becoming missions. Now, this is making a mockery of the word mission. I would like the Honorable Minister to review the structure of the National Health Mission, to make it far more focused, far more pointed, to have a starting date and to have a final date as far as the mission is concerned, and not convert all vertically integrated national communicable disease programs also as missions. So the fourth issue that I want to raise is on governance issues. The standing committee, I have been a member of the standing committee for the last 2 years. And we took up the issue of governance of public health systems. And I think the government of India should make a beginning by demonstrating a completely new approach to governance to the systems that it controls and it governs before it gives advice to others on what governance should be. And what better place to start than the All India Institute of Medical Sciences. So we have given a detailed report on the changes required in order to make the All India Institute of Medical Sciences a better place, a better health ecosystem. So I have no doubt, I have no hesitation in saying that the All India Institute of Medical Sciences is one of our few world-class institutions. It is world-class because of the quality of the students and the quality of the faculty. Now, we must give them a work environment conducive to their talents, conducive to their capabilities. Today, sir, the work environment in AIIMS is like a bus station. It's like a railway station. It's just impossible. I salute the people who are working in AIIMS for their degree of commitment, their degree of social sensitivity, because under the conditions under which they are working, most of which has been imposed by government, some of which has been imposed by parliament. I think this is really commendable. So we have given a detailed report on how AIIMS should be better governed. And it's not just a question of AIIMS Delhi, because the same system in AIIMS Delhi is now being replicated all over the country. First it was 6 AIIMS, now there is going to be an AIIMS in every state. And you know, I'm sorry to say, sir, the best signal the health minister can send that he means business for good governance is by resigning his role as chairman of the governing body of AIIMS. There is no reason why the health minister of India should be the chairman of the governing body, not only of AIIMS Delhi, but AIIMS Bhubaneswar, AIIMS Jodhpur, AIIMS Raipur, and all the other AIIMS. You must bring professionals. You must allow professionals to manage these institutions professionally. And I think the Honorable Minister will see in the Standing Committee report a large number of these recommendations, which I hope he will take seriously. Sir, I know you're looking at the watch. My final point, and this is very topical, very relevant, because yesterday the Supreme Court has passed a sweeping order taking over the MCI virtually. So on the 8th of March, I had the privilege of presenting laying on the floor of the House, on the table, the Standing Committee report, the 92nd report on the functioning of the Medical Council of India. This took us 8 months. This is the first time that a Standing Committee actually examined the functioning of the MCI. This report, in my view, is a landmark report because it not only looks at the functioning of the MCI, but also looks at the structure of undergraduate and postgraduate medical education. It also looks at the mix of public and private. It also looks at the fact that today 60% of all the medical colleges in India are in 4 states, and how to make medical education and medical training more widespread in our country than is the case so far. So I wish and I request the Minister to take this report very seriously. It seems that the Supreme Court has taken the report more seriously than the government. This is a very unfortunate situation. It is the job of the government, whether it's NDA or UPA is an immaterial issue. It is the job of the government to reform MCI. MCI must be reformed. It is the job of the government to reform undergraduate and postgraduate medical education. That must be reformed. And it is the job of the government to ensure greater regional distribution of medical infrastructure, including colleges. I don't think that we should abdicate this role to the Supreme Court, with all due respect to the Supreme Court, or to this three-man committee that has been set up by the Supreme Court yesterday. So I think if the government means business, I would request the Honorable Minister to come to Parliament with a law, with the new MCI law that the Standing Committee has recommended, and you will find all party support for that law, because all members of the Standing Committee unanimously have given that report.
Okay, thank you.
So finally, I
No,
will
5 points,
request,
all the fives.
no, finally, sir. Finally.
5 means 5.
So you have been so kind, allow me for 1 minute more, sir. Because I know tomorrow you will not be kind, so I'm making full advantage of this kindness of yours. So I would request the Honorable Minister, one issue that has bothered me for many years is that as a country, we are not paying adequate attention to the issue of environmental health. I think environmental issues today are extracting a huge morbidity cost as far as public health is concerned, whether it is air pollution, whether it is water pollution, whether it is land degradation, whether it is chemical contamination. I think we are beginning to see increasing evidence of the fact that morbidity, if not mortality, morbidity is being influenced heavily by environmental factors. I think I would request the Honorable Minister is an unusual man because he's been both Minister of Environment and Minister of Health in the state government. So he should be in a better position to be appreciative of the point that I am making, that increasingly environmental issues are extracting a public health cost, and we must intervene decisively before it becomes too late. Sir, I thank you very much for giving me this courtesy to be the final speaker.
Very valuable points. Thank you for the very valuable points. Honorable Minister.